What if I told you that just a few small daily habits could significantly reduce your blood pressure without medication, without expensive supplements, and without extreme diet? In this video, I will be sharing 9 proven strategies that I recommend to my patients to help lower their blood pressure naturally. Before we look at the strategies, let's quickly refresh our understanding of high blood pressure. Blood pressure is the force of your blood on the walls of your arteries. The force when your heart contracts is known as systole, which is the upper number. The force when your heart relaxes is known as diastole, which is the lower number. You see, your blood pressure varies during the day and different things can impact or affect your blood pressure reading. However, when your blood pressure is persistent over this threshold, that is known as hypertension. So now, let's dive into the top 9 ways you can naturally reduce your blood pressure. Number 1 is diet. A particular diet known as the DASH diet is known to reduce your systolic blood pressure by 11 millimeters of mercury and your diastolic blood pressure by 5.5 millimeters of mercury. This diet is rich in fruits, vegetables, low-fat dairy products, and also low in salt and saturated fat content. It is recommended that adults should consume less than 6 grams of salt, which contains 2.4 grams of sodium in a day. Just to give you some idea, a teaspoon contains 5 grams of salt. This is your overall salt intake, and consideration should be given to additional seasoning used in food. Reducing your sodium intake to 2 grams daily will reduce your systolic blood pressure by 5.4 millimeters of mercury and your diastolic blood pressure by 2.8 millimeters of mercury. While sodium constricts your blood vessels and increases your blood pressure, potassium, on the other hand, relaxes your blood vessels and help lower your blood pressure. Increasing your dietary potassium can reduce your systolic blood pressure by 3.5 millimeters of mercury and your diastolic blood pressure by 2 millimeters of mercury. Studies have shown that food rich in potassium such as banana, potatoes, salmon, spinach, egg, and tomato juice will help reduce your blood pressure. However, this strategy is not suitable for everyone. If you have certain conditions like congestive heart failure or kidney disease, or perhaps take certain medications that help your body to retain potassium, this strategy might not be suitable for you. Different forms of exercise such as the aerobic exercise training, the dynamic resistance training, the high intensity interval training, and the isometric exercise training are all significantly effective in reducing resting systolic and diastolic blood pressure. However, recent studies cited by the British Journal of Sports Medicine have shown that isometric exercise training is the most effective mode of reducing your resting systolic and diastolic blood pressure. Adults should aim to engage in strengthening exercise that targets major muscle group, and finally try and break long period of inactivity. Maintaining a healthy weight is another important strategy. If you're following the DASH diet and staying active, then you should have noticed some improvement in your weight. A 5-kilogram weight loss is known to lower your systolic blood pressure by 4.6 millimeters of mercury and your diastolic blood pressure by 3.6 millimeters of mercury. If you have conditions such as type 2 diabetes, pre-diabetes, or obstructive sleep apnea, then maintaining a healthy weight always has a positive impact on these conditions. Stopping smoking is one of the most effective intervention on your blood pressure. According to this study, a total of 721 participants attended the smoking cessation program in an outpatient clinic of a tertiary medical center in Taiwan from 2017 to 2018. At the end, it was found that stopping smoking significantly reduced the systolic and the diastolic blood pressure of the entire cohort. And these results were very significant in the hypertensive group when compared to the non-hypertensive group. Another one is alcohol. Alcohol has been identified as a major contributor to high blood pressure. Studies have shown that individuals who drink 3 or more standard drinks daily have 3-fold increased prevalence of mild hypertension when compared to the non-drinkers. Current UK guidance recommend limiting alcohol intake to 14 units per week for both men and women, and this should be spread across 3 days. Reduction in excess alcohol consumption lowers your systolic blood pressure by 4 millimeters of mercury and your diastolic blood pressure by 2.5 millimeters of mercury. The next one is sleep. Most people need about 8 hours of sleep every night, but everyone is different. Many studies have shown that sleeping less than 5 hours a night or having interrupted sleep or people with conditions such as obstructive sleep apnea are more likely to have high blood pressure. This is because your blood pressure during the time when you're sleeping can be up to 20% lower than your blood pressure reading during the day. The final strategy is dealing with stress. When you're stressed, your body releases hormone known as adrenaline, which is your fight or flight hormone. This hormone causes a rise in your heart rate and your blood pressure as a means of helping you cope with the situation. Stress alone won't cause you high blood pressure, but it is known to be linked to unhealthy lifestyle choices. You're more likely to turn to unhealthy lifestyle choices such as drinking too much alcohol, not exercising, binge eating, and smoking as a way to relieve stress. You see, in the moment, these habits may temporarily reduce your stress, but if you do too much of them in the long run, it may damage your heart health. So it is important to recognize and understand what is causing you stress and find ways to deal with it. So guys, here are the 9 proven strategies that I recommend daily to my patients to help them reduce their blood pressure naturally. If you're enjoying this content so far, thank you for watching. Kindly consider liking this video and subscribing to the channel for more educational content. That's it from me, guys. I shall see you in my next video. Bye for now.